So look, welcome all. My name's Tony Sara. I've been the president of ASMOF New South Wales for quite some years now. So I just click up my speaking notes. I think I won't take that call if that's all right. This is a fairly momentous time for us as a union and you as staff specialists. We've had a wages cap for 12 years. As a result, we have slipped significantly behind other states and territories. The Labor government's been elected, and one of their platforms is to do interest-based bargaining for essential workers, and that includes us. But in that 12 years, we have gone behind significantly other states and territories, $50,000 to $100,000 more to go north of the Tweed or south of the Murray. So look, let's sort of take the bigger picture about us. ASMOF has been a very long-standing advocate for staff specialists and what staff specialists do. It's teaching, it's research, it's training, it's models of care, it's junior doctors, it's medical students, it's specialist trainees. We have looked at the public hospital system and patients as the primary drivers for our interests and our advocacy. We are not just about the members. It's quite clear that the current awards, all four awards that we cover, which is the Staff Specialist Award, the Medical Officer Award for Junior Doctors, the CMO's Award and the Medical Superintendency Award, are very poor. They haven't been updated in many years. There is the sense that they were written for a different time in medicine. If the consultant needed to be contacted or do something, to be a phone call from a registrar and they would say, yes, I agree with that, thank you, and go back to sleep. Those days have gone, particularly for the procedural specialties. So the award has completely inadequate provisions for on-call, recall, shift penalties, overtime, and it is clearly far worse for procedural specialties. But people have to go back now. I see Dr. O'Connor is there, and that's now extended to psychiatrists. So the world has changed, and public hospital practice, medical practice has changed, and there is much more need for the consultants, for the specialists to either be on site or go back. There's also been some quite marked changes to the rights of private practice and the level of private health insurance held by the community and the community's willingness to use that. So as a result of these things, our awards have failed to keep up with other states, as I've said, and we are losing doctors to interstate, we are losing doctors to VMO arrangements, and we're losing doctors to the private sector. And that's certainly been in the news last year with Sydney Kids, particularly for the anaesthetists and the intensivists. They could not recruit to save their lives. The minister, you may have seen him on television towards the end of last year, it was put an advertisement in the paper. The Liberal government would not engage with us prior to the election as to what there might possibly be in terms of award reform. They were not interested. And so as a result, those craft groups of Sydney Kids, they are still in dire need. There is a dire need for psychiatry. There's about 50 to 60 staff specialist positions vacant in psychiatry. They are converting staff specialist positions to VMOs at 0.6. So the teaching, research, training is going down in those fields as well. There is no great push by registrars to get into psychiatry. So the awards clearly are just not cutting it. So we've got a Labor government. We've got a once-in-a-generation opportunity to do something about this. New awards, fair conditions for doctors. We want public hospitals to recruit and retain the doctors we need for a world-class health system. So this is once in a generation, once in a lifetime. It is $50,000 to $100,000 more north and south of the borders. Will we get what we need? It's not known. You will see in the recent budget $3.5 billion set aside as an essential services workers fund. How much of that will we get? We have no idea. Is the minister on our side? We think he is. Is the government on our side? That's unknown. We've got the nurses, we've got the health services union, we've got the teachers, we've got the police, we've got the fireys. There's a broad range of essential services workers that will want a piece of that $3.5 billion. Is Treasurer on our side? Possibly, not sure. Is the Ministry of Health on our side? We think they are. Do they have experience in bargaining? No, they don't. They've had 12 years of saying, nick off, we're not going to talk to you. So the outcome that we get will be dependent on a broad range of factors. One will be on you, on how many members we have joined up. The more, the better. The more people we have signed up, the bigger the stick we carry, the piece of 2 before. It will be partly dependent on what other unions achieve. It will be partly dependent on the strength of our campaign, on how well we document the issues and the difficulties between us and Queensland and Victoria. So we're starting that process tonight. We need to get a sense from you, the members, what the issues are now. As I've said, I think it's on-call, recall, shift work, penalties, overtime, weekend work. But you, the members, need to tell us what those issues are. So we're having about 40 meetings across New South Wales in various hospitals. But as well, we're going to have specific purpose meetings with those craft groups, with the psychiatrists, with the ED doctors, with the anaesthetists, the intensivists, the imaging doctors and the ONGists. They're all fields where you can make significantly more in the private sector or as a VMO, and we need to make sure that whatever deal is crafted, if at all possible, takes care of the interests and the needs of those craft groups so that they also can recruit and retain. So, as I've said, tonight is the first in one of 44 meetings. There will be others at your hospitals and your sites. There will be ones with specific craft groups. We need to engage you. You need to get more people to join. You need to give us your views. You need to engage with us. Will everyone get what they want? The answer is no. Will we all get what we want? I suspect the answer is no as well. $3.5 billion doesn't go far enough. But quite clearly, the stronger we are, the more we're likely to get, the more fact-based our cases, the more likely we get awards that will allow us to recruit and retain anaesthetists, intensivists, psychiatrists, ONGists, imaging doctors, and so on. So thank you very much for joining. I'll just see how many people we've got. 216. That's a really warming the cockles of my heart approach. We've got so many people on the first meeting. So look, I'm going to hand over the staff and they will go through the details and what the processes are going to be to try and get a big case made and to engage with you and to get lots of people to join so that we've got a bigger piece of 2 before to take to task with the government. I'll hand back to Sarah. Thank you.
Thank you, Tony. And look, I had a PowerPoint presentation. Tony's actually covered a lot of it in a really good way. So I'm just going to have a conversation, just me and you, 218 of us here, about what this is all about. We know it. New South Wales public hospitals are losing doctors. Doctors aren't being treated with respect. Certainly they once were, as managerialism has increased, and we've seen the increase of non-medical management and budgetary decisions overriding clinical expertise. We've also seen that employment conditions for doctors in many cases are unfair. You know, work isn't properly recognised, whether that's the level of skill or the hours in terms of on-call, recall, etc., or the overtime for JMOs. We've seen, as Tony said, that the employment conditions didn't contemplate the current complexity of medical practice that we're seeing today in the modern world. And it makes sense. It makes sense why people are looking towards VMO, locum, other arrangements, why they're moving into state and why they're moving into the private sector. And that's because New South Wales medical awards are the worst in the country. I want to make that really, really clear. New South Wales medical awards in the public health service are the worst anywhere in Australia. And we want to fix that. And we can fix that and we will fix that. But we're going to need to do it through a campaign. It's not going to happen automatically. We also know that the more vacancies there are, the harder it is to recruit. It becomes a vicious cycle. It means that there's work intensification for those of us left, and it means that there isn't the time to do the teaching, the research, the clinical protocols, that high-level public service work that really value adds to the community. So what we need is fairer awards, and the way we can do that is through this award reform round in 2024, which is coming up on the 1st of July, 2024. That's our target date. And what we need to do is keep doctors in New South Wales public hospitals. So what does that mean? Well, I just want to be clear, this is for every single medical officer who works as an employee or as a salaried medical officer in New South Wales in the public health service. It's for all the JMOs, it's for the CMOs, it's for the staff specialists and for the medical superintendents. This is absolutely for everyone who is an employed doctor in New South Wales Health. And indeed, it really will affect VMOs indirectly because some of them may want to come back into the system. Some of them may want the security of employment. Some of them may want some of the benefits that we can negotiate, if we can negotiate award conditions that put us at the best of the country, not at the back of the country. We need to make these awards fair and we need to make them competitive with other states. So we need to recognise the work that people do and make sure that these awards actually compensate people adequately. And that, again, we're not trailing the country, that we're leading the country. There was a time when New South Wales led the country, but that, over the last 12 years of a wages cap, was a long time ago. And what does that mean practically? It means both cost and non-cost items. I'm not going to say this is about wages. Of course, that's a part of it. Of course. Of course, it's about monetary conditions. But every one of you has a story. Every one of you would have a story about some of the bugbears that really affect your quality of work life at your work that we could address through award reform. Might be access to TESOL. And how do we change that to make it fairer, easier, better? I mean, there's one way to do that, and there'd be procedural timelines that are legally mandated in the award. There are other ways we could change that. Now, I don't want to preempt that conversation now, but this isn't just about money. There are a whole lot of non-cost items that we see in nursing and midwifery awards, that we see in police awards, that we see in a whole lot of public service awards in New South Wales that we don't have as medical officers. So we need to make these awards, as I said, competitive with other states, fairer, and we need to update both cost and non-cost items. How are we going to do that? Now, some people will call that a strategy. Some people will call that a theory of change. Part of the MBA that I'm studying, it's called a theory of winning. But it's basically how are we going to achieve what we want? Well, as Dr. Sara said, we need to work collectively. We need to have the big bit of 4B2. We need to have power wielded responsibly and wielded in the interests of both our members and the public health system. The first step is to build together collectively in a democratic way a set of asks, a set of claims. In union world, we call them a log of claims, but this is our vision for how we think employment conditions should be. And I want members and non-members alike, I want all doctors to take a really broad view of that. We have a lot of scope to change things. Now, as the President said, whether we're successful will depend on how much support we can build behind this campaign. But we need to aim really high. We need to push hard and we need to go into this with a set of claims, a vision for how doctors in New South Wales should be compensated and their conditions of employment that we think is best practice. So that's the first step. And to that end, tonight we're announcing that we have 43 more consultation meetings, as Dr. Sara said, both at A1, A2, A3 tertiary referral hospitals. There's 12 meetings on site physically. That will also be accompanied by a meeting online for every local health district and meetings for relevant craft groups, of which we've got a short list, but we're certainly happy to address any craft group that would like to have a say directly on the issues that affect their specialty. And we know that some specialties operate, or we know for a fact that specialties operate in different ways. And so there will be different parts of the award that affect them. Finally, we will be having a meeting for JMOs because we know that JMOs have unique and different concerns with their award, which is a different award and a different way of working than the others. So there'll be a broad range of consultation and that'll be emailed out to everyone. So that's the first step. We develop our claim and we engage with doctors. And that means members and non-members alike. We want to be clear, unless we have broad participation, unless we can get our membership up, unless we can show that we have the bargaining power, unless we can show that when we're at the negotiating table with New South Wales Health, unless we can show that we have the support of 2/3 of the medical officers working in New South Wales, they're not going to move. They're not going to move. Now, nurses have done it, teachers have done it, and we can do it too. I have no doubt about that, but we need to get together and we need to operate collectively. So the first thing is build our claims. And I encourage you, as I said, to get your colleagues to participate in that process. The second is we need to grow and we need to stand united. We need to be the biggest in the room, and we need to claim our fair share of that $3.5 billion essential workers fund that's been budgeted for, because other unions and other professions will be claiming it. And if we don't, we'll miss out. If we don't run this campaign, nothing will change. If we don't run this campaign, that $3.5 billion will go to the squeakiest wheels. It'll go to the nurses, it'll go to the teachers, it'll go to the police, it'll go to the public servants. And not only will us as a profession miss out, not only will us miss out, but ultimately the patients and the people of New South Wales miss out. We owe it to the people of New South Wales to advocate on their behalf to keep doctors in New South Wales public hospitals. I want to make that really, really clear, that this is about exercising power, yes, for us, yes, to achieve justice in our workplace as medical officers, but also for the public. Because we know if we can't properly staff and fill these hospitals, we can't make sure that the teaching, the training, the research is going on, then everyone in New South Wales is worse off. So that's the second step, is to grow support, to be united. And then the third step is, and will be, negotiating with New South Wales Health. Now, we'll do that, and we'll seek to partner with colleges, we'll seek to partner with other relevant stakeholders. We want to be as big and as bad as possible. And we're hoping, as the President said, we do believe that New South Wales Health is on board. They can see the problem. They can see the difficulty they're having in recruiting in many specialties. But we need to give them the ammunition. We need to give them the cover. We need to give them, or their political masters, the reasoning or the rationale to do it. We need to give them the logical case, but we also need to be prepared to show them that if they don't do this, not only will they get the entirety of the workforce offside, and that will cost them, morale is key, but also that it'll become a political issue for the government, because again, this is about keeping doctors in New South Wales public hospitals. And if we do all that, if we grow our support base, if we have a claim that we can all get around and support, and it won't be perfect and it won't be everything that everyone wants, but if we can develop a vision for how our awards should look as of 1 July 2024, if we can get everyone on board, if we can start running both a public campaign, but also showing support in the workplace by attending meetings like this one, attending meetings like the consultation, talking about it in MSCs, talking about it in RMOAs, talking about it with our colleagues. If we can do that, we can win. We've seen the nurses do it. The cost to the government of nurse-to-patient ratios is massive. And frankly, it's quite unprecedented to have that in an industrial instrument in New South Wales. It's never been done in any profession to mandate a certain number or a certain amount of employment. We've seen the teachers do it. Again, huge pay increases, radical increases. We're not talking about 2 or 3% tinkering around the edges. They fundamentally elevated the rates of pay for junior teachers, but also expanded the money available and the conditions available for those who are mid and late career teachers. So we've seen it done. And we've seen it happen in other states. What we're asking for, we will seek to be the leaders in Australia. We will seek best practice. We will seek to be the benchmark of which every state compares themselves to. That's our aim. That's where we should be aiming. That's rightly where we should be aiming. But we're not asking for anything more than what's been achieved in other states. I want to be really, really clear on that. It's not unrealistic. We're not going to be asking for double or triple what Queensland or Victoria has, but we should at least have parity. Every single person working in New South Wales should not be paid less because they work south of the Queensland border, north of the Victorian border of the River Murray. And if we do that, we'll do something really good for the medical system and for the patients in New South Wales. So it is about power. but it's about wielding power for a good cause. It's about making sure we have a world-class health system and we can continue to staff it. So I'll finish up by saying this. It doesn't matter what your partisan politics are. It doesn't matter what your partisan politics are. I'm sure some people here voted Liberal. I'm sure some voted Labor. I'm sure some voted Greens. You're intelligent people. You understand the power analysis here. That if we stay united, if we stay together, if we have a broad enough coalition and we get the public on side, we will win. And we've seen other unions do it in this state. And we've seen other unions do it, other medical unions do it in this country. So if nurses can do it, if teachers can do it, we can do it. We can do it. We have a campaign to do it. We will do it, but it needs your participation. So come to the consultation meetings that we will be publishing tomorrow. Come along. Talk to your colleagues. Can't stress that enough. Talk to your colleagues about it. Discuss it in MSCs. Discuss it in RMOAs. Discuss it in your tea rooms, on your wards, in your colleges. Discuss this. Find out what people are wanting. Let them know that they can be a part of it. And eventually we will be asking them to join, both join the campaign and join ASMOF. And you will hear me say that a lot if you come to these meetings. We need people to join. I tell you, it's not out of self-interest. It's because I know that's the way we win. New South Wales Health, through the reporting of the Industrial Relations Commission, through their own, signs of visible activity in the workplace, they know how strong we are. For a long time, unions were able to rely on the perception of power, even though sometimes membership had whittled away underneath that. Well, we need to demonstrate our power. We need to demonstrate our collective. And the way we can do that is have managers have it reported back to them up the chain that people are talking. People are talking, people are talking. So as I said, get vocal, come to the consultation meetings, bring a colleague, and ultimately we need to grow the union so that we can have strength at the bargaining table.